I never thought I'd be addressing our gala guests from my office and not gathering with you in the beautiful American Visionary Art Museum. Although I have to say, our Annapolis Health Center is looking pretty good. While I wish we could celebrate our shared commitment to the mission of Planned Parenthood of Maryland over a wonderful meal, we know that the gala is not just about one shared night. It's the celebration of another full year of vital care provided to our patients, and that we can really do from anywhere. So thank you for tuning in for this special acknowledgement. We started 2020 with some amazing facilities and programmatic expansions. These additions to our work will forever change how PPM practices healthcare and how PPM's patients are better served. In January, we cut the ribbon on this beautiful Annapolis Health Center, which has doubled the size of its former space and created a safe, friendly, and affirming place for our patients to receive top-notch health care. We also introduced care coordination to address the intersectional social and behavioral challenges that our patients are facing, and also launched gender-affirming care, offering hormone therapy for transgender, gender nonconforming, and non-binary patients. In July, we toasted to the opening of our newly renovated and relocated Towson Health Center, and we are excited to do this once again in the fall, when we also relocate and reopen the Owings Mills Health Center. Together, Baltimore County will have more than double the access. As the healthcare landscape continues to change, all of our communities need and deserve these safe, high-quality spaces to receive their care. I want to especially recognize the tremendous service to our patients in the last 6 months during the COVID-19 pandemic. Our staff has really shown that they are true to the mission of providing care no matter what. COVID-19 has really highlighted the caliber and commitment of the Planned Parenthood family, from our providers and clinic staff delivering high-quality, compassionate care in our health centers and via telehealth, to our educators and advocacy teams showing up virtually in classrooms and communities, and our administrative staff members behind the scenes. Each member of the PPM team is dedicated to delivering our mission. During this pandemic, like every other business, the way we operate has had to be re-engineered quickly. Our outstanding staff handled constant changes to services, safety measures, schedule changes, and more, moving quickly and thoughtfully to ensure their patients and their teammates are safe while ensuring the services continue, services that are so needed in the community. I'm proud to say all of PPM's health centers have been able to remain open throughout COVID-19 using a mix of telemedicine and limited in-person appointments to keep care happening. Part of our response was to reduce our number of in-person visits to allow for distanced patient flow. And we are now increasing backup capacity and continuing to incorporate telehealth appointments where possible. But our demand continues to grow, and COVID-19 has highlighted just how important it is to maintain PPM's services. Our healthcare systems in this country must address the disparities and inequities that our patient populations have always encountered. At Planned Parenthood, we have always believed that access should not depend on your income, zip code, or race. And now, more than ever, we need to ensure that equity is at the center of our work to ensure communities are receiving the care and support they need and deserve. I'm so grateful for the leadership of our Chief Medical Officer, my colleague, Dr. Reagan McDonald Mosley, who has been a key director for our team's very nimble and critical response, with our patients' safety and care always at top of mind.
There is no denying that these are challenging times for Marylanders when it comes to health. Healthcare professionals across the nation are working tirelessly to combat the effects of COVID-19 while continuing to take care of our patients and communities' routine health needs. At PPM, we've adjusted all manner of care to make sure our patients' reproductive healthcare needs are being met, whether through telehealth or through safe in-person visits at our health centers. And we know that for many of our patients, we are the sole health provider that they may see this year, and we assume great trust serving in that role. It is critical that we work to ensure our patients receive safe, compassionate, and non-judgmental care, and that they do not have unnecessary barriers to accessing care. However, we also know, and the current pandemic has highlighted, that people of color historically have significant barriers to accessing quality health care, including reproductive health services. As our nation confronts the COVID-19 pandemic, we at PPM and as a community must address the public health crisis that racism presents. The country's underinvestment in Black and Latinx communities has led to less access to healthcare and dramatic healthcare disparities. COVID-19 is disproportionately ravaging the health and economic stability of the Black and Latinx community here in Maryland and across the nation. These disparities are loud and clear amid the pandemic. Economic inequality, structural racism, and public health failures have translated to exponentially higher COVID-19 infection and death rates in the Black and Latinx communities. Discrimination creates a barrier to health, both inside and outside the doctor's office. The stresses of anti-Black racism, microaggressions, and discrimination take a toll on the health of Black people. Planned Parenthood fiercely values bodily autonomy for all people. Full bodily autonomy is the ability and freedom to make personal decisions about your body without judgment or persecution. We are acutely aware of the challenges our patients face. As a critical component of our public health system, PPM works every single day to address disparities and be there for the patients who need us most. Throughout this pandemic and beyond, our patients will need us more than ever. And I'm proud to work with the dedicated staff in our health centers as we bring new meaning to providing care no matter what.
Now, for a few shout-outs. I would like to thank our board for their continued support and leadership, particularly in these challenging times. I also want to thank the Gala committee, who did so much work to create a wonderful evening that celebrates and supports our work. We may not be in person, but their efforts raised $100,000 to support our programs and services this year. To our volunteers, they extend our staff's efforts, and they do so out of their personal passion and commitment. I wanted to extend my gratitude in particular to our clinic escorts, who stand in front of the health centers to visibly show a friendly, welcoming, and safe entry to our patients, oftentimes standing next to the protesters who create the opposite atmosphere. It takes guts, patience, and passion to do what you do, so thank you. To the wonderful partners and supporters in Annapolis, specifically our supporters in the Maryland General Assembly, who protect what we do in health centers and fight for our patients every day. Our work wouldn't be possible without our reproductive healthcare champions in the state legislature. This year's efforts in our abbreviated legislative session cannot be overstated. The impacts of introducing and passing telehealth legislation were not just felt by our patients at PPM, but by healthcare providers across the state. We are so grateful to the lead sponsors of our telehealth bill, Senator Cheryl Kagan, Senator Clarence Lamb, and Delegate Sandy Rosenberg. We knew this legislation would expand access for our patients at PPM, but we had no idea to the speed and scale its impact could have on the entire state as COVID came upon us. Finally, I want to thank each and every one of you who has taken the time to learn more about our patients, our work, and supported us. You volunteer your time, you lift your voices, and contribute financially to make this happen. Because of you, last year we served 26,000 patients across our 7 health centers in Maryland. Your support makes a difference. Thank you for standing with Planned Parenthood. I hope you'll take a moment to appreciate our dedicated Gala sponsors and honorary committee members, as well as the hardworking committee that has worked on our special event. And if you can, please consider making an extra donation to PPM in honor of the work we've carried forward during the pandemic and in honor of the patients who rely on our services, especially